Good evening, everyone. Good evening to our viewers from all around the country and all around the world. This is OTalakayan Season 2, Episode 4. Today is August 1, and welcome to the fourth episode of OTalakayan, an online interview program where we tackle different topics and issues in OT practice and education. So, hello, Kim.
Hi Lee, how are you?
I'm good. How are you? Maulan dito. Diyan ba?
Walang ulan dito sa Tarlac. So
Dito
what
sa
are you up to? What are you up to right now?
right now, well, I'm still preparing kasi next week we start our internship program at De La Salle, and classes are starting soon also. So talagang full swing ang preparations namin. Kayo ba?
Even for us, our classes will resume on the 13th. So
Mhm.
the OT faculty members are busy preparing all the materials that we
Mhm.
will be utilizing come the opening of classes. And I think this is a very timely topic that we have right now for Otalakayan. The previous
Actually.
episodes we really allot a considerable amount of time for the clinician, but it would also be important for us to tackle the possible telehealth options that educators would have,
Mhm.
especially right now that we are in a pandemic.
Mhm.
So when you say telehealth, it wouldn't just be the provision of your clinical programs, it would also include provision of your health professions education that future OTs would be having.
Mhm.
So I think this is a very important and timely discussion that the OT educators would really need in order for them to train future OTs.
Yeah, kasi it can be very challenging. Ngayon pa lang, no, ako habang prepare kami, nararamdaman namin na this would be very challenging, not just for the students, but also for us. Diba?
For the faculty because
Oo.
it wouldn't just be technology. You have to really incorporate and consider a lot of things to make it seamless for the benefit of our students. And I think our speaker and our reactors would really provide us with vital, interesting, and contextualized sharing as to really help our OT educators. So Lee, maybe you could introduce to our audience, our speakers and reactors for today's
Oh,
episode.
all right. So for tonight, we are very blessed because we have three guests. So one is our speaker, and the other two would be reactors. So I'll introduce our speaker first. Ang nakikita nyo ngayon, kasama natin ay si Dr. Carl Froilan Yochico. Carl graduated from St. Louis University School of Medicine and the University of Santo Tomas College of Rehabilitation Sciences. Physical therapist din si Doc Carl, no? Before siya rehab med. He's now a clinical associate professor at the College of Medicine and the Philippine General Hospital, University of the Philippines, Manila. He's also a consultant at St. Luke's Medical Center, Global City, and Quezon City, as well as Manila Doctors Hospital. He's also doing research. So he's a research affiliate at the Institute of Aging at UPNIH, and he's the chair of the Tele Rehab Committee of the Philippine Academy of Rehabilitation Medicine. Hi, Carl. Thanks for joining us tonight.
Hi, Lee. Thank you very much for inviting me.
Okay. So, aside from Doc Carl, we have nabanggit ni Kim na we have two reactors. So we got an OT who is teaching in a university and an OT who is doing clinical teaching naman in a hospital. So, pakilala ko muna, we have Karen K. Tuibeo right here. She graduated from the University of Santo Tomas in 2014, and she also graduated with a degree in Master of Science degree in Occupational Therapy in 2018. She is now a clinical internship supervisor at Jose Reyes Memorial Medical Center, and she's been doing it for 5 years. No? So hi, Karen.
Good evening, everyone.
Thanks for joining us tonight.
Thank you din sa pag-invite.
And we have Nikki Pestaño. So Nikki graduated from Veles College in 2015, occupational therapy, and she's currently finishing her Master of Arts in Occupational Therapy at Cebu Doctors University. She's currently an instructor at Veles College since 2015. So she'll be our reactor from the university. Hello, Nikki.
Hello, everyone.
Yeah, so thanks for joining us today. So let's get to our topic na, Kim.
Maybe before we proceed dun sa mga tanong and particularly for the technical side as to how we could deliver instruction through telehealth, maybe Doc Carl can provide us an overview of current telehealth or current tele-rehab programs that we have right now.
Okay. Hi. Good evening, everyone. First of all, thank you very much to the organizing committee and the entire board of the Philippine Association of Occupational Therapists for having me included in your webinar series. And congratulations on your OTalakayan, right? That's how you call it. Okay. Now, please allow me to share my screen. Okay, Sir Kim, can you see my PowerPoint slide?
Yes, po.
All right. Okay, so now let me share with you our experience with telerehabilitation in particular. But this time, we're going to talk about telehealth in OT education and training. I think this topic is very timely, especially during this pandemic. And we know that the adoption of telehealth was somehow catalyzed by the COVID-19. But we have to admit that the adoption of telehealth, at least in our local setting, is less than expected. And there are many factors affecting the adoption of telehealth, including human factors, organizational factors, and technological factors. But for the purpose of this presentation, we're going to talk about the effect of the lack of knowledge and skills, not only of current, but also of future healthcare providers affecting the adoption of telehealth. Because we have to realize that the healthcare providers are the major drivers of new technologies or innovations in health. And because of paternalistic medicine or healthcare, at least in our setting, our patients follow or heed the advice of the healthcare providers in general. And I think this is a very good topic to discuss because we have to spread awareness, first and foremost, to the healthcare providers, to the current healthcare providers who will train the future up and coming healthcare providers in the future. Okay? Now let us start with the definitions of terms. More often than not, we often interchange telehealth, telemedicine, and there are other terms like teletherapy, telerehabilitation, telecare, and even telepractice. But according to this reference, Brennan in 2009, he defined telehealth as the use of electronic means, meaning to say the use of information and telecommunications technologies to support long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. So these are the key terms. Clinical healthcare, as mentioned a while ago by Sir Kim. It also includes health-related education. So it's not just the delivery of clinical services, but also includes education, public health, and even administrative aspect. In contrast, telemedicine is the subset of telehealth that specifically pertains to the electronic delivery of healthcare services. But there's this misconception that telemedicine is only delivered by doctors. Well, according to World Health Organization, telemedicine and telehealth can be used interchangeably, just to avoid confusion that telehealth, in the broader sense, is delivered just by doctors, but rather it is delivered by any healthcare professional. Okay, so I think PAOT is right in using the term telehealth because it just not refers to clinical healthcare delivery, but also delivery of education, public health, and health administration by healthcare providers in general. But it can also be termed as telemedicine if we're going to stick to WHO's definition. So it's very inclusive. Okay. Now, under telemedicine or telehealth in the broader sense is telerehabilitation. And now, this is where our specialty lies. Telerehabilitation in the shorter definition does not include teleconsultation alone, but rather, unlike other specialties which just focuses on providing teleconsultation, in our treatment armamentarium in rehabilitation, we also include the delivery of rehabilitation services. So that's the multidisciplinary approach to treatment of our patients, including physical therapy, occupational therapy, speech and language therapy, and even psychology in some hospitals. It's under rehabilitation medicine, and also prosthetics and orthotics. Now, for the purpose of this discussion, we're going to define telerehabilitation as the provision of evaluation, rehabilitation management, and patient education to patients over a distance using either synchronous or asynchronous electronic means. And this includes remote supervision of therapeutic interventions like therapeutic exercises, such as the one on the screen. So there's this remote therapist demonstrating in real time the exercises prescribed to the patient. And in advanced countries, there are virtual reality applications and even body or wearable sensors that the patients can wear in order to keep track of the patient's response to exercise remotely. And telerehabilitation, let's remember that it's not a new intervention or new technique, but rather a new way of delivering the usual rehabilitation services. So just like in the clinic, we provide assessment. So after doing thorough history and physical examination, we do appropriate intervention planning. We monitor the patient for follow-up. We supervise them during therapy. We educate not just the patient, but also the family. We provide consultations and counseling. And the benefits from telerehabilitation are varied according to literature and according to local experience. We provide less need for travel for patients, right? Between rural communities and areas with rehabilitation facilities, which are mostly often located in tertiary hospitals, or at least in urban areas. We have to admit the fact that there are limited rehabilitation centers throughout the country, not enough to accommodate everyone or the nearing 110 million Filipinos throughout the country. And given the archipelago geography of our country, it's hard to deliver rehabilitation services to remote areas. That's why there's the term GIDA, the geographically and isolated disadvantaged areas, where persons with disability are in need of rehabilitation services but are unable to access them because of lack of facility, lack of manpower in that area, and lack of empowerment in the community, enabling them to provide rehabilitation on their own. So telerehabilitation can actually overcome the barrier of distance, time, and even cost of healthcare or of rehabilitation services. Especially during this pandemic, we cannot travel just as much as we did before the pandemic. And in terms of social distancing, so telerehabilitation may indeed play a role because not all outpatient rehabilitation clinics are open. And if they are, they could only accommodate so much, right? Because of social distancing. There are limited slots available for patients. And I'm not sure if we have inclusion criteria to accommodate or prioritize those who are really in need of rehabilitation more than some patients who might be able to still exercise at home without even going to the hospital. Another benefit from telerehab is better clinical support in local communities, delivery of local healthcare in the rural areas. We improve access to specialized rehabilitation services, and we provide indirect educational benefits for the patients, the family, and even the remote clinicians who are not adept in rehabilitation, and students who participate in teleconsultation. So this is what we're going to talk about. The students who participate eventually in teleconsultation or in teletherapy, or in your terms, telehealth. We reduce also the feelings of isolation for rural clinicians. And lastly, because it's something involving technology, it is multimedia that is enjoyable, varied, and interactive. And the scope of telerehabilitation services can span from catering to musculoskeletal disorders, which are most commonly seen in our telerehab practice. But there's also increasing number of stroke cases accessing telerehabilitation. We can also prevent or even treat pressure ulcers through telerehab and monitor their response to treatment. In advanced settings, they also apply virtual reality technologies. Speech language disorders are treated by telerehabilitation. Seating and wheeled mobility prescriptions and vocational rehabilitation assessment can be done by tele. So in terms of the technique, it could be synchronous or real-time or asynchronous, which has the time delay element. And this is called store and forward technique. And there's also the hybrid or the combination of both, depending on the patient's needs, familiarity with one another, and technical capacity and resources. So we have to take into consideration the resources and the technical know-how of both sides, not just the patient or the caregiver or family member there, but also on the other side, you have the rehabilitation provider. So in terms of synchronous telerehabilitation, you can do phone call if you do not have access to the internet. But if you have, you can do audio call, or better, if not best, you do video call, which is the optimal technique to do telerehabilitation. And asynchronous techniques include text messaging, but of course, this has limitations and risks. Email, file sharing, and remote monitoring of response to exercises. So before the pandemic, we followed the ideal setup of telehealth in general by following the Health Insurance Portability and Accountability Act, or the HIPAA. And this ensures data privacy, compliance with ethical and legal standards to protect not just the patient, but also the healthcare provider. However, during this pandemic, we cannot blame that these standards have somehow eased, of course, in the spirit of solidarity. And we would like to cater to our patients real time or at the soonest possible time. And so somehow we have resorted to using any available telecommunication method, application, software, or website that can be accessed by both patient and the rehabilitation provider or healthcare professional on any available electronic device to which they are accustomed. But of course, early on during the pandemic, it is very nice and relevant that the different rehabilitation professional organizations have come up with their telerehabilitation guidelines in order to provide guiding principles and uh, like key pointers for the healthcare providers in conducting teleconsultations or teletherapy. Just like in PAOT and PARM, for instance, so we've created the telerehabilitation guidelines in response to this pandemic. But even before the pandemic, in PGH or in the University of the Philippines, Manila, we have already integrated telerehabilitation in our medical curriculum because according to our manual, the student's handbook of medical students in UPCM, the learning programs should enable them to fulfill their fullest potentials as physicians in training. And one application will be the Rural Community-Based Health Program. We integrated telerehab in that community health and development program. Because first and foremost, even before the pandemic, it's always been hard for people from rural and urban areas to access rehabilitation services. And now, during the pandemic, even those in the urban areas or those with the nearby rehabilitation facilities cannot access rehabilitation services now. But there are already studied factors why access to rehab is limited because of the lack of nearby rehabilitation personnel, facilities, lack of financial or transportation capabilities on the side of the patients. And there are limitations due to disability. The lack of knowledge of what rehab can offer and the poor compliance to outpatient therapy. And there's also caregiver fatigue and lack of motivation. Therefore, there's this program called CBR or Community-Based Rehabilitation. And this empowers communities to respond to their own needs, especially of those with disability. However, CBR cannot be done during the pandemic because we still have to maintain social distancing. That's why telerehabilitation can be a viable option. And we partnered with the Community Health and Development Program, and we were able to touch base with one of the towns in Amiga, Cavite. Amiga stands for the 5 towns in Cavite, which are partners of UPCHDP. So this one is Alfonso Mendez, Indang, General Emilio Aguinaldo, Amadeo. So we partnered with one of those towns. And if I may show with you or share with you our telerehabilitation planning or experience in UPPGH. I'll just share a new slide. Okay. So here, we started with planning. We defined the problem or we assessed the needs of the community in terms of their rehabilitation needs. And then we tried to develop learning objectives in relation to our medical students rotating in the community. We developed or we conducted key informant interviews, focus group discussions. We provided orientation lectures on telehealth or telerehabilitation, and we conducted community visits in order to check their available resources and see what things we could provide for them in order to enable telerehabilitation. The phase 2 is implementation. We prepared the equipment with the help of the rural health unit in Alfonso, Cavite, and also in partnership with National Telehealth Center. We conducted several rehearsals and dry runs on the proper conduct of telerehabilitation. And then we did our first trial by simulating the telerehabilitation session within PGH. So in PGH, in our department, we dedicated 2 separate rooms. And then one room, there's the Tele community team, quote unquote. And then on the other side, there's the Tele-Rehab team. And we tried to connect to one another and then tried to simulate the tele-rehabilitation session from the introduction of members and then to the setting of objectives, to the introduction of the case, and further management. And then we did the second trial between the actual community and then the UPPGH. And lastly, we evaluated the program or the experience by collecting data from participants in terms of satisfaction, in terms of their learning experiences with the program. And we conducted informal interviews and we heeded their recommendations. So here, we conducted planning on phase 1. During our focus group discussion, we invited representatives from the National Telehealth Center housed in UP Manila. We also had representatives from the Department of Family and Community Medicine to represent the Community Health and Development Program. We invited the Rural Health Unit Municipal Health Officer and her staff, and the different representatives from PT, OT, speech, and psych. We also conducted community visits and dry runs. And this is the municipal health officer helping in the technological setup. And those are the medical interns. During the implementation, the interns demonstrated their physical examination to us, and we tried to correct them real time if needed. So this serves as a teaching learning activity for them. We also asked them to evaluate the posture of the patients in different views, depending on the case. And we also tried to conduct gait analysis. And on the side of the tele-rehab team, we have the different members of the rehab team witnessing the actual tele-rehabilitation referral. So on the telecommunity side, the medical interns refer the patient to us. Okay. So there. So we're able to witness the actual physical examination of the interns through tele-rehab. And this physical therapist now is demonstrating or instructing the exercises to the patient and correcting the patient accordingly. And lastly, we did evaluation. So we followed this Kirkpatrick's model of evaluating the program, as we will later discuss. Okay. So I'll go back to my slides. Now, in terms of telehealth or telerehabilitation, we have to be guided by these principles. So of course, PAOT has its own principles, PARM has its principles, because currently we don't have a unified telerehabilitation guidelines. But we can always adjust as we go through the learning curve of telerehabilitation. So as long as we provide the best possible care or assistance that can be given to a patient within the scope and limitations of telemedicine, then we're all right. We should always observe proper decorum and etiquette similar with in-clinic patient encounter. We have to ensure safety of the patient, and we have to provide efforts to secure informed consent and protect data security, provide compassionate healthcare, and observe the 4 bioethical principles we learned from our school days. So that's beneficence, non-maleficence, autonomy, and justice. So just to depict the telerehab setup, we see this diagram. So on one side, there's the rehabilitation medicine doctor or therapist, and then we have the patient with the family member. or without a family member, and with or without a remote healthcare provider, connected to each other through internet, or if there's no internet, we settle with phone call. But of course, this telerehab setup is affected by the willingness of stakeholders, interdisciplinary cooperation, the technical support, and of course, administrative support. So we have this equipment in UPPGH, and we have the two sides of the telerehabilitation session. On one side, the telerehab team, and on the other side, the telecommunity team. So the process of telepresentation, when we orient our students on the proper conduct of telerehab, of course, we have to start with the introduction of all personnel in both sides. So you have to acknowledge the presence of those present on the telecommunity side or on the side of the patient in order to ensure privacy. Because as much as possible, we would like to limit the number of people witnessing the telerehabilitation session on both sides. Okay? So one way to do that is to recognize those who are present in both sides. You also have to establish house rules before conducting the telerehabilitation session, such as there should be no photo taking or video shooting of the telerehab session. And also you have to observe proper decorum and even proper attire during the telerehabilitation session. And then down the line, you conduct the history taking, virtual exam, you provide your teledisposition, assessment, and teletherapy program. So these are examples of a telerehabilitation session wherein the patient now returns the demonstration of the exercises instructed to her. Okay. So these are the students whom we involved during the telerehabilitation session so that they will learn the physiatric principles or the rehabilitation theories. Okay. And we also engage the different members of the rehab team to educate our patients. And this is, I think, my last slide. I've mentioned a while ago that even before the pandemic, we've incorporated telerehabilitation in our medical curriculum. And LU means Learning Unit 5, Learning Unit 6, Learning Unit 7, representing third year, fourth year, and fifth year medical students who rotate in rehabilitation for a certain period. And during their rotation with us, we introduce already telerehab in a stepwise approach, starting with introduction of the principles, and then later on, as they go to clerkship, they are taught about the methodologies, the content, and the technique of conducting telerehab. And when they reach internship, that's when they participate in an actual telerehabilitation session. Okay, so with that, thank you for your kind attention. I will now stop the screen sharing. Thank you.
Thank you, Carl, for that synthesized version as to how we could utilize telehealth, the existing programs, and giving us a guide if ever we'll be incorporating it to our program, to our curriculum, what are the important steps or processes to take. So at this juncture, we could look at to it in two phases or in two layers. First would be we educators would be utilizing technology because of the restrictions that COVID imposed to us. And the other consideration would be because we don't know as to when this would stabilize, it would also be worth considering to incorporate in our curriculum or probably in our instruction how to harness or how to train future rehab professionals or OTs in using telehealth because that could also be another competency the future OTs would have. So it wouldn't just be the teacher utilizing technology, it would be worth considering to on the part of the university or in the part of the clinical programs to also develop telehealth competencies for our future students. So maybe we could go now to certain questions. So given that presentation, what do you think would be the important competencies that an educator should possess or should have in order for him or for her to utilize telehealth in his or her instruction?
Okay. Before I proceed in answering the question, Sir Kim, uh, I think what you pointed out a while ago is very interesting and also called for. I think it's about time to include telehealth in the curriculum of our undergraduate students. In other countries, they have already adopted telehealth and incorporated instructional materials or educating students on telehealth in their curriculum. So now, although uh, it was because of this pandemic that catalyzed the adoption of telehealth services, at least throughout the country, hopefully, we have to educate the future healthcare providers. But we cannot do so if the current healthcare providers are not adept on telehealth. Okay, so that's why I think at this level or at this point in time, both current and future healthcare providers, at least in our setting, are at equal footing in terms of competencies. So this slide, if I may share with you, might be the same for both healthcare providers, current and future healthcare providers. So in terms of competencies, there's this study that recommended skills training for telemedicine or telehealth for undergraduate nursing students. But I think their proposed learning outcomes are also applicable to healthcare providers in general. So such as the knowledge of telehealth. So both current and future healthcare providers should demonstrate the knowledge of the operation of telehealth services and even patient monitoring technologies. No? They should be able to uh, demonstrate proper attitude or open-mindedness even towards this innovative technology. Uh, in doing so, or in before you can actually develop positive attitudes, you must be able to learn the telehealth theories in terms of the process, the benefits, the risks, and the limitations, and how to address these risks and limitations. And hopefully, by having a good background or a theoretical knowledge of what telehealth can offer to our patients, we would develop a better understanding and proper attitude or open-mindedness towards telehealth. We have to recognize that telehealth is very useful in our setting because, as I've mentioned a while ago, there are limited rehabilitation professionals throughout the country. I think there are only about 3,000 OTs, if I'm not mistaken, about 2,900 plus. And there are only about 300 physiatrists throughout the country. And to serve how many Filipinos now? About 110 million. And according to the website of the Department of Health, about 1.4 million Filipinos are classified as persons with disability. Okay, and aside from that, the geographical landscape makes it hard for people to access rehabilitation services. So even beyond the pandemic, I think telehealth should stay. So that's why we should develop these competencies and prepare our future OTs and our healthcare providers in general for providing telehealth to our patients in remote areas. Another competency is the provision of technological skills. So we should be able to demonstrate skills to train the patient to use the equipment or to train the family to use the equipment if needed. No? Of course, the healthcare provider must himself or herself be adept in using the technology. And we should also be able to apply skills to check equipment for functionality and do troubleshooting if needed. And pre-pandemic, of course, we always taught our students the bedside manners. But in the case of telehealth, we should learn webside manners. And this entails optimal visualization, how to conduct proper body language and speech. So we have to adjust communication speed, body motion, and even gestures during the conduct of telehealth. We have to dress appropriately. Some students are even required to wear their usual uniform as they would do face to face during the actual telehealth session. So it's up to the the clinical supervisors or the schools, no, or the hospitals uh, to provide those guidelines. So we also have to teach our current and future healthcare providers on how to angle the camera depending on the need for the particular physical examination. We have to also adjust the lighting and even the framing of videos. And we have to also understand the standards of care, so such as providing or ensuring privacy and the proper uh, administration or execution of the therapeutic program. So we have to abide by our clinical practice guidelines as well, but we have to be creative in delivering these usual OT interventions in a more innovative way now. So using the technology. And another core competency for telehealth should be the ethical use of telemedicine. So in that case, we have to highlight mutual trust and respect between the patient and the healthcare provider. We have to provide ways to ensure confidentiality, privacy, and data integrity. And we have to learn how to properly obtain proper informed consent. We also have to value autonomy and privacy of the healthcare provider and the patient, and ensure that the quality of care is rendered. And lastly, we also have to learn how to interact virtually in the clinical scenario. So, such as ensuring proper environmental assessment. So, we have to ensure that the patient on the other side is safe, right? So, meaning to say, there, for example, if we're going to uh, conduct teletherapy, ensure that the patient has a stable baseline vital signs. So we have to teach the patient or even the family, we have to empower them on how to conduct vital signs monitoring if needed, no? Or if they're not uh, adept to do so. Or if there's a healthcare provider in the family, so we have to uh, engage them in the actual telehealth session. When we're going to examine gait, for instance, we have to ensure that there's no clutter on the path. Okay, so we have to ensure safety in terms of environmental assessment. And we also have to engage in group interaction. So we have to provide management of family and the group dynamics. So I think that's it for the competencies, Sir Kim.
Mhm. Thank you very much, Carl. Yeah, and so you've mentioned earlier that during the planning phase, you included developing learning objectives. No, I guess this is for the students,
Yeah.
for the medical students. Now, kami kasi in occupational therapy, so as you know, the final year of undergraduates is usually spent for internship, and before that, we have classroom subjects, and somehow students transition to from classroom to clinics. Um, Delivering services, in particular OT services, is one thing, and delivering it via telehealth is another. So I would like to ask, what telehealth competencies or outcomes should be expected of undergraduate students then? Is it something of parang mas bawas pa yun? Mas meron bang competencies na parang professional na talaga? Is there such a thing?
I think it depends on the curriculum of OT in general. Of course, I'm speaking from the medical curriculum. Uh, the topics from first year to internship are already too much. No? Or they're already saturated with too much knowledge and skills that they have to learn for face-to-face healthcare delivery. And now you're going to introduce telehealth or telemedicine into the curriculum, and that might be too much for the students. So one way to address this is to telehealth, weave it through the existing activities or the learning programs. It doesn't have to be an entirely new subject in OT, no, dedicated solely for telehealth, but rather you could design some cases, for instance, wherein telehealth could be useful.
Mhm.
Okay, so in that case, you could already teach the students the value of telehealth, at least in our local setting, and making them aware that telehealth exists even abroad. So if ever they're going to practice abroad, you're actually preparing them for telehealth already. And after you've made them recognize the value of telehealth, so that would be attitude. And now you're going to teach them about the theory of telehealth or the theoretical background of telehealth. So that means to say how you're going to conduct it properly, the legalities, the ethical considerations of telehealth. You can probably interject these things, in your cases. So it depends on how you will develop your cases, your learning programs. Pre-pandemic, there was this study that dealt about education and training of healthcare providers on telehealth. And according to this systematic review, they've already found some countries, although they only included 9 studies that met their eligibility criteria, uh, which means to say that there are only limited uh, studies on this particular topic, education and training of healthcare providers on telehealth. And according to that systematic review, uh, learning programs on telehealth exist in 2 forms. Most commonly, you have your CPD activities. So these are short-term learning activities for usually the current or the licensed healthcare providers already. But the other less common learning platform for teaching telehealth to healthcare providers is the university undergraduate courses,
Mhm.
or sometimes uh, graduate courses. For instance, here in the Philippines, we have medical informatics,
Mhm.
teaching the proper conduct of telehealth. So yeah, so I think it depends on the creativity of
Mhm.
educators, how they can weave telehealth through the existing learning programs.
Alright, thank you, Carl. Siguro punta naman ako sa ating dalawang OT educators, no? Similar question. Pero sa inyo, I would like to ask talaga. So, have you already made changes, for example? Kasi 'di ba OB tayo ngayon, so learning outcomes are very important for us. Have you already made changes in outcomes, or what were the considerations that you made in terms of teaching telehealth among our undergraduate students? Siguro mauna na ako sa university muna, kay Nikki.
Hi, Lee. So sa ngayon, kakatapos lang ng summer term namin, ng mid-year term. Pero prior to the pandemic, we have online platforms na of learning. Tapos such as assigning homework and providing supplementary material. Pero as of now, yung students namin in this coming yung students namin this mid-year term, ano pa lang, kaka-start pa lang nila sa clinical subject. So, hindi pa masyadong na-apply yung pagpo-provide ng telehealth. So, we're planning to most probably include that sa next semester, because I think what Doc Carl said about community-based rehabilitation, na hindi umaabot yung services to rural areas, I think that's very relevant kasi ngayon pa nga lang, nahihirapan na kaming mag-provide ng CBR services online kasi, di ba, pag sinabing CBR, dapat andun ka, you're interacting with people. Tapos, to provide it on a virtual or an online platform would be very good. Hopefully, I think we have CBR next semester, so we're definitely gonna include that.
Very timely, no?
Oo nga.
Oo, thank you, Nikki. How about kay Karen? Kamusta kayo sa JRMMC? May telehealth na ba sa internship natin?
Yes. We are running tele-rehab sessions already for 1 month now. Yun.
Wow.
So, noong March, actually, we already implemented virtual internship program because it was an immediate concern since last batch na ng university na to, and sabi namin, bak sayang naman, 1 month na lang, tapos instead of, parang sayang yung experience or yung learning na pwede naming maibigay through online. So, we tried, although hindi siya ganun ka-polished, there are still limitations. For instance, that time, sarado ang outpatient department, so we have no patient-therapist interaction. So, nakapag-run kami ng virtual. Yes, sarado yung OPD. Actually, up until now, sarado siya. Nakapag-run kami ng internship program na walang patient-therapist interaction. So what we did was we revised our clinical training program, and then siguro mas focus kami more on the lectures. Meron din kaming mga clinical analysis, pero yung videos, more on lifted siya through internet. Pero we made sure na yung videos na pinapakita namin, may opportunity yung interns to evaluate yung mga yung mga tinitignan namin skills sa OBE grade sheet namin. Then, yun, siguro ang limitation lang is wala kami actual patients that time kasi wala pa kaming tele-rehab. Pero for sure, kung magkakaroon man ng virtual internship program, of course, katulad nga nung sinabi ni Dr. Carl, na yung competencies na to, kailangan mag-reflect din siya sa OBCE grade sheet namin.
Yeah. Thank you. That's very creative actually. And these are counted in the clinical hours ng interns natin. No? Kung kami rin naranasan din namin yan. Talagang kailangan mo siya maging creative ngayon. No? Baka later on ma-discuss pa yan, no? Sa ating tanungan. So thank you, Nikki and Karen and Carl. I'll get back to Kim. Kim?
And on top of that, we don't know rin kasi nga as to when everything will be stabilized. So it cannot just be the provision of strategies online. We need to also accept the reality na this could be a possible service delivery. Not totally eradicating naman face-to-face or direct patient supervision through face-to-face, but this is really worth considering. Now, we wouldn't be able to expect our future OTs to be like that if there wouldn't be any direct intention on the part of the educators, be it in the university level or in the internship level. So the next question would be directed again to Carl. How are you designing your teaching learning strategies or activities? Maybe you could give our audience ideas as to how you have so how you are targeting the competencies that you have mentioned, sample strategies that you have utilized when training healthcare professionals.
Okay. Sir Kim, may I share my screen?
Sige pa.
Thank you. Okay. The question is how to design, right? Our teaching learning activities. To answer that, we can probably follow the model by ADDI. No, actually, ADDI is not a name, but rather an acronym for analyze, design, develop, implement, and evaluate. So these are actually 5 steps, and it's not a linear process, but rather they can go back and forth. So in terms of the ADDI instructional design, we start with the analysis phase. And the analysis phase can be considered as the goal setting phase. Here, we have to put the student at the center. So we have to determine first his needs or her needs, no, the student's needs in terms of telehealth competencies. Okay, and so this includes the questions: what is the typical background of our students, or the OT interns, right? Depending on your uh, curriculum. So when will you inject telehealth in your learning program? Would it be as early as third year or only as interns? So yeah, you also have to define the task and topics that you will include in your telehealth programs. So we've already discussed that a while ago. So on the earlier slide, so these competencies, we've discussed these thoroughly. So the contents of those competencies you might want to include in your topic or task analysis. And then the second step will be to design. So you have to design your learning objectives with these tasks or topics in mind. Then you have to sequence those learning objectives accordingly. You have to design your instructional strategy. How will you deliver those learning activities? And how will you evaluate them? And the third step will be to develop the actual teaching learning program. You have to develop further the content. So based on these topics that you've identified early on, if you want, you can also create a storyboard and your courseware. And the fourth step would be the implementation. You have to institute the program and distribute the learning materials to your students, and you have to manage the learners' activities. And finally, evaluation consists of the Kirkpatrick's model. So you have to determine the reactions of the students with your telehealth program. So by interviews or focus group discussions or surveys at the least. So ask them regarding their perceptions of the program, their the strengths and weaknesses of the program, and their recommendations. The second part of the evaluation will be learning. So you have to objectively assess if there's a change in their knowledge and their skills pre and post telehealth sessions, and see if their behavior has changed as part of the telehealth program. Okay, so I think that's one way of designing the program.
Okay, and maybe we could proceed, Doc Segura, with the activities that you have utilized or that you could suggest to our viewers.
Okay, so now in terms of teaching learning activities, how will you achieve those learning objectives or realize those competencies? So as we've mentioned, we would like to teach the current and the future healthcare providers the theoretical basis of telehealth. So you can do this just like in the classroom activities, no? Or if it's still pandemic, you can do online based techniques. But of course, you have to adjust to the varied technical resources of your students. So you have to keep that in mind. So whether they are capable of online activities or if not, uh, at least asynchronous electronic activities, or if really low tech, then you will just have to settle with well, low tech means use of phone call. So are you going to conduct telehealth sessions through phone calls. Of course, those have limitations, but it does not mean that phone call uh, telehealth sessions are not allowed, because there's this Harvard University course on telehealth that actually employs phone calls to conduct teleconsultations, and that is being done even abroad. And even now in our local setting, the more common uh, telehealth technique, because of course our financial resources and the technical resources of our patients, and the lack of internet connection in some areas, and the low internet bandwidth, we settle with phone calls. So it's up to the educators, no, or the administration, what technology or technique they're going to settle with, or they're going to allow to conduct telehealth. So with that in mind, you have to teach the students uh, the process, the risks, the benefits, and the limitations of that particular technique. So if you're going to allow phone calls, then you should uh, teach the students about the risks of just relying on phone calls. And then you're going to teach the students on active listening skills in order to catch some clinical findings just through phone call with the patient. So you have to teach these skills to your students. And if you're going to settle with online-based techniques, then you also have to teach proper conduct, proper decorum. So those that we have described a while ago, uh, as early as pre-engagement with telehealth sessions. So aside from theory, you also have to do experiential education. So this now entails immersing the students in telehealth sessions. But before doing so, you might want to demonstrate first how it is done. You can simulate with your students. Then you can engage them in practical sessions with the role playing, for instance, and with an actual patient. Or you can also do apprenticeship learning. So this is, for instance, with the guidance of the clinical supervisor. So meaning to say, in one telehealth session, you have the patient on one side, and on the other side, you have the licensed OT, the clinical supervisor, and physically co-located with the student, or even remotely connected with the patient, with the student. So you just have to remember to ask informed consent from the patient. So if he's going, or she is going to allow the student or another third party, no, participant in the telehealth session. So if in case the patient allows, then you can ask him or her, the patient, no, if we can even allow the student to conduct history or perform physical examination remotely, and even conduct therapy sessions. If not, then you can just have the student observe, and then later on evaluate or have a discussion of what transpired during the telehealth session. Okay, so with that, thank you.
Okay, thank you, Carl. Maybe we could have the reactors to, it may be outcomes related to telehealth, or it may be outcomes not really directed to building telehealth competencies. How are you designing your teaching learning strategies right now? And what are the sample strategies that you are utilizing, be it in the university or in the hospital setting? Maybe you could start with Nikki.
Hello po. So, sa ngayon po, yung ginagamit namin, the LMS, or the Learning Management System of VELES, is still in development. So right now we're using Google Classroom, and mostly asynchronous kasi we have many students who aren't from Cebu City, and it's difficult for them to access uh, internet. So mostly asynchronous, tapos we upload lang materials, and then they go through them at their own time. Sometimes there are also synchronous quizzes or discussions naman po. And then as for the outcomes, as much as possible, we adjust them so that we can still evaluate their learnings even if di kami nagkikita face-to-face or di sila nakakatanong in real time. And yung sa sinabi ni Doc, yung um, reactions on the conducting of classes, we have regular monitoring naman po kasi we have the students write weekly reflections so that we can adjust our learning instruction if they can suggest something better or how they're feeling about the program on how it's handled po. So I think we are working on it along the way because everything's still very new, and we're all trying to adjust pa po.
Okay, I would agree to that when everyone would be so new to what is happening right now. And it would be really inevitable for us to have all of these apprehensions, all of these tensions, fears, and all that. But what is important is we're really doing something. And I would also agree with that one. It wouldn't just be the asynchronous uploading of materials, it would also be important that there will be continuous dialogue or continuous interaction between the educator and the student because we won't really know how they are coping or reacting or even adjusting to the new mode of delivery. So all of those feedback mechanisms should also be in place. How about in the hospital, Karen?
I agree with Dr. Carl na your learning strategies depends on your learning outcomes. So, internship is a very skill-based program, kaya lahat ng ginamit naming platform is synchronous talaga. So, we used online discussions, role-playing. There was an instance na I pretended as the caregiver of the patient and the intern would conduct interview kasi we need to verify the skills of the intern. Hindi lang just merely explaining the process or the questions to be asked kasi we need to verify if talaga bang pasado yung skill ng intern sa standards namin, sa department namin. And then bago namin sila isasabak sa actual patient. Kaya nga lang, again, the limitation is hindi pa running yung tele-rehab namin that time, so hindi namin siya na-verify if talaga bang maki-carry over siya sa actual patient. Pero hopefully, in the near future, kung magkaroon man ng tele-rehab or ma-push yung virtual internship program, mostly baka mga synchronous platforms po yung gagamitin. Yeah.
Okay, thank you very much, Karen, Nikki, and Doc Carl. So now we have, okay, so I think we still have time for one question from the audience. No, one question from the audience. So what are the challenges in teaching telehealth as a service delivery model? Baka pwedeng unahin ko muna si Carl. What were the challenges to you in teaching telehealth as a service delivery model?
Okay, I'm going to speak about my pre-pandemic experience in teaching tele-rehab to our medical students. Well, because it was pre-pandemic, so telehealth or tele-rehab was actually not commonplace, at least in our country. And naturally, the medical students were somehow aloof with the value of telehealth or telerehabilitation. So that's one. So lack of awareness of telehealth. But well, because of the pandemic, the value of telehealth could not be overemphasized now. Okay. So another challenge pre-pandemic in educating the medical students on telehealth is probably the conduct of the telehealth session itself. Of course, we're trying to teach them the proper technique, no, from the introduction phase, no, how to even secure the informed consent, no. So there's three major steps in conducting telerehabilitation: the before, during, and after telerehabilitation sessions. So you have to uh, tell our students that there are many things or prerequisites prior to the actual telehealth encounter. And I'm sure the OTs who are into telehealth these days know that there are a lot of preparations before the actual telehealth session. So one of them is securing informed consent. But aside from that, there are many other things like teaching the student, the family, the patient on the technical process of the telehealth session, how to monitor the patient's response to exercise. So you have to teach them on self-monitoring guidelines, vital signs monitoring. No, you have to teach these things to your students as well because they're the ones who are going to instruct the patient. And then during the actual telehealth session, you have to be creative in performing physical examination. Of course, you cannot touch the patient, no, unless you have someone in the family of the patient who is knowledgeable in health sciences, right?
Yeah.
Nevertheless, you have to be creative in determining the range of motion, determining the strength of of a particular muscle. You have to engage the patient in actual activities of daily living. So we have to take advantage of seeing the patient in his or her home environment. No? So in that case, we might be able to even integrate home modification techniques or counseling. No? And then, so I think that's a challenge, how to teach virtual physiatric or rehabilitation examination, and even how to provide the therapy services. So that's another thing. So that's a whole lot of.
Yeah.
And after the telehealth encounter, you also have to teach the value of documentation, proper documentation, which students pre-pandemic did not recognize well. Now, of course, they thought that this was just an academic requirement. But when you're into telehealth sessions, you will have to properly document each encounter in order to protect yourself and the patient as well.
Yeah. Thank you very much, Carlia. Oo nga, I can relate, no? Lalo na sa documentation, OTs are, well, the internship program of OTs is known for having many documents. We do a lot of paperwork and pre-pandemic pa lang, it's already a source of problem for many. At siguro lalo na ngayon, if we do everything electronically, there's also a risk of that being a hack, for example, no? Yung mga ganyan na kinatatakutan natin, lalo na considering confidentiality because these are health related documents, no? It has personal information. So thank you, Carl. How about si Karen? Ano nang challenges in teaching yung na-encounter nyo? Kasi nagte-telehealth na kayo, nag-teach na kayo sa internship eh. Ano nang challenges na na-encounter ninyo?
During the virtual internship program, siguro mga challenges, siguro number one is yung burnout ng interns kasi interns were less motivated kasi there are concepts that they cannot visualize and it would be better if these concepts are taught face-to-face. So parang medyo less motivated sila. Lalo na lalo pat nag-start yung internship nila na face-to-face as biglang nag-virtual. Parang ang hirap. So we got lucky kasi they have background na eh. So parang ang role na lang namin nung nag-virtual internship kami is to verify their knowledge or their skills. Yun. And then siguro another challenges, siguro restricted na rin yung exposure nila sa different modalities kasi sa telehealth, kailangan yung resources na gagamitin mo is kung ano lang yung available sa bahay ng patient. So, talagang hindi na nila may experience yung iba't ibang modalities na napakarami, lalo na sa OTs. Yun.
Okay, oo nga naman, no? Talagang work with what you have. Pero let's face it, no? Hindi naman lahat ng resources available sa clients natin or kahit sa bahay ng mga interns, no? Hindi naman natin mapapadala lahat ng pwedeng gamitin. Okay, so I think that's it. Kim, meron ba tayong mga...
Or maybe Nikki can also share
yes.
challenges
Sorry,
that
Nikki. Challenges in teaching.
Oo. Sa ngayon, yun yung pinaka malaking challenge siguro na di lahat may access to internet. So, even if you provide them with materials that they can go over in their own time, it's still going to be quite difficult for them to access those. So, I think yung magkwento ko konti. One of our subjects this mid-year term is ergonomics. And diba, if we have ergonomics, we're gonna have projects to go and observe a worker and the workplace. And it's very difficult kasi pag hindi nila ma-visualize yung reality ng setting ng workplace, it's gonna be difficult for them to create interventions and programs also. So what we did is we had them simulate the worker na lang and the workplace in their own homes and brainstorm together on how they can provide interventions and programs to the worker. So sa ngayon walang parang real workers na i-assess. Tapos yun, one other challenge would be on how we're gonna conduct the teletherapy or telehealth for internship. Kasi Doc Carl or Karen, this is a question for you. How are you going to conduct online therapy with clients na? Are you gonna be with the interns when they conduct the sessions, or what if sabay yung schedule ng intern, so parang paano nyo gagawin yun?
What do you mean? Hi Ma'am Nikki. What do you mean sabay yung schedule?
Like for example po, dalawang interns may they have patients at that same time. How are you gonna do that po? Are you gonna schedule the interns one by one lang muna and then you're gonna be in the virtual na session, or how are you gonna do that po?
Okay. I think this depends on the rules that the specific clinic will allow. So for instance, if the clinic serves private patients, right? So you have to consider asking for the consent from these private patients if they're going to allow even at least one non-licensed or a trainee, no, to sit in during the actual telehealth encounter. So if the patient will allow, then you try if he will allow two. So I think this depends on the guidelines that the clinic will provide. So because the informed consent should say that during the actual telehealth encounter, you may be accompanied by the licensed OT, but since we're having interns in the clinic, we also engage this number of trainees to observe or to, depending on the clinic, no, if you're going to allow to engage the patient with the trainees. So I think it's up to you po and the patient.
Okay po, thank you.
Sina Karen ba? Para sa inyo?
Actually, ano pa yan, pinag-uusapan pa kasi technically bawal talagang meron yung presence ng intern kasi it would be awkward kasi you have tatlo kayo na
Oo
Parang
nga.
feeling ko maiilang yung patient. So parang hindi pa namin na-explore yung area na yon sa ngayon.
Mhm. Kasi ako I would imagine, no, yung sa tanong ni Nikki, I would imagine na nandun yung preceptor or supervisor the entire time kasi 'di ba pag internship parang the student clinicians deliver the service under full supervision. So you may imagine parang hindi ka makakapag-supervise ng dalawang interns at a time or tatlo or apat. Parang isa-isa lang siguro. Pero tama, ano? Kuha ko rin yung point ni Karen na parang awkward niya. may audience kayo sa teletherapy, no? Which is, I think, very intimate.
No. I
Okay.
think that's a very good question yung kay Nikki.
Mm.
So we have to be creative in designing our teaching learning activities, no, our guidelines for each telehealth encounter. We have to consider whether the patient is paying or a charity service case, because
Mhm.
each scenario has advantages and disadvantages. So for instance, if the patient is paying, then I'm not sure if he or she will allow a lot of time just to be interviewed by a trainee, no? Uh, and then on the other side, yung charity case, if you're going to allow the intern to interview the patient, then baka hindi pa tapos yung intern, natapos na yung internet connection ng patient.
Oo nga.
May limitation ng internet kapag charity, for instance, no?
Aha.
Of course, this uh, depends case to case. So, I
Mhm.
just thought of probably uh, we should be creative in engaging them in telehealth sessions, not always synchronously, but sometimes asynchronously. Probably a pre-recording of a telehealth encounter, and then they will critique, or a simulated role playing, yung mga ganon. Okay.
And I think too, regardless of the strategy that we're going to utilize, it would also be important to really, be it on the part of the student receiving our instruction as to what is
Mhm.
expected of them, what will be the changes, what
Mhm.
would be their tasks, what could be their possible responsibilities right now. So that's one. And then informing to the patient, the caregiver, if ever this would be utilized in the clinical setting, as to what will happen during the teaching learning scenario. There wouldn't be any number naman or a template that we
Mhm.
could really adopt. It's more of informing all stakeholders so that it would be clear to all. And we wouldn't be doing any ethical breaches along the way as we utilize this platform.
Yeah.
There. So
Yeah.
I think we have reached the end of our
Oo nga. Diyos ko.
program, Lee. Maybe I could siguro synthesize whatever was discussed right now before you go to the promotion of our next
O-
events, Lee.
Okay,
So
okay.
it was discussed that it would be inevitable and it would be also recommended that telehealth competencies would be addressed inside the university and inside the clinical setting. And it would entail a lot of considerations from the planning to the implementation and even to the evaluation. And it would be so important to really consider the needs, okay, of all of the stakeholders when we design our instruction. And that would happen even if it is not telehealth that we are talking about. Primarily, if you're assuming the role of an educator. And yes, there will be challenges that would be part of the initial process. But what is important is we are taking steps and we are not limited by the restrictions imposed by the pandemic. And we can just hope that we will be improving as we go along through this path or this journey. So thank
Mhm.
you, Doc Carl. Thank you, Ma'am Karen and Ma'am Nikki, for sharing to our audience your insights and your experiences when it comes to teaching learning. Okay?
Thank
Thank,
you.
thank you very much for being with us, Carl,
Thank you
Karen, and
din.
Nikki. It's a great pleasure to have you as our guests.
For sure.
O-
Thank you.
Okay,
Thank
so
you.
for our viewers, so please do not forget to like and subscribe the official PAOT YouTube page. This video will be available even after the live. And so it's youtube.com/PAOTINC and our Facebook page as well for details and updates. Now, this year, because it's the pandemic, we will not be having a physical mid-year or annual convention, mid-year assembly or annual convention. But members, please save the date. On August 30, we'll be having a members meeting online. So details to follow as what time it would be and what platform we'll use. No? And one last announcement. So given the emergence of various highly subjective social media posts discrediting the profession, we released an advisory yesterday, clarifying the domain of OT and stressing the principles that influence the service delivery and educating the public on various issues affecting pediatric practice. So you can download this advisory online for free. The link is posted on our Facebook page. Ayan. So, again, thank you very much to our esteemed resource speakers for joining us tonight. Thank you, Kim. And thank you for our audience. Tonight, we hope to see you on the next episode of OTalakayan. So, magandang gabi at good night.
Good night.
Night everyone.
Thank
Bye-bye.
you. Bye-bye.